Hi, thank you for joining us in The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me today is my colleague and co-author, Wendy Benson. We're receiving some very positive feedback from viewers about this series, and we're thrilled to continue sharing this extension of our first book. Today, we're talking with a very special guest, Jan Steiner. Jan is the managing partner at Senior Transitions Concierge. Having gone through the process of finding the right cure for her parents and watching others as they struggle through the most difficult task, she realized this was a serious need for support for seniors transitioning. Jan's passion is to help families through this very stressful time, and she's undoubtedly been a tremendous resource for 2x2 Health. We are thrilled she is here with us, so let's get started.
We're so glad to have you with us, Jan. Thank you for joining us.
Thank you. Glad to be here.
So why don't we start off by, why don't you tell us a little bit about what you do?
Well, what I do is basically I walk with the family through the process of finding the best services and communities for their senior loved one, being sure that they can navigate the waters and have someone there to be their advocate.
And that's such an important time when someone's going through those really important decisions for themselves and their loved ones. I mean, how do you go about doing that? I mean, ordinarily it can be overwhelming and confusing. And now, you know, being faced with the pandemic for the last several months, how do you help people during those such critical transitions now during this time?
Well, basically I sit and listen to what their needs are, what the requirements are, what's going on with mom or dad, and just find out, can we help them move into a community at this time? Or would it be best to bring services into their home to help them navigate in a familiar environment? With the COVID pandemic, at first we couldn't move people in unless it was an emergency. So because of that, we brought in a lot of different types of services to the parent and basically just took the burden off of the family to give the care, because who of us are really professionals in the caregiving world?
And so when that happens, when is the ideal time to start planning for something like this?
The planning, I always think, should be done when you're healthy, when you're able to make decisions for yourself, and also when you can really, if you decide you want to move into a community, when you can really go and enjoy the services, the activities, and the other people in the community. Oftentimes, though, it doesn't happen that way. People wait until there's a crisis. But one of the most important things in your planning is to be sure you have a power of attorney arranged, not only for your health, but your property. That's really a key to a successful transition, no matter what.
Yeah, so important from, taking our patients to the doctors, and, something we always talk about is make sure somebody knows your plan. Mm-hmm. Because if nobody knows that plan, we can't make it work for them. So that is so important. And we have used you, countless times when we have a patient and you don't know what you're going through it until you're going through it, right? And you just don't know how difficult it can be. And you have just been a huge help for us. I mean, this is your area of specialty, and we really enjoy working with you.
Well, thank you. What I have found with the families, like you say, you go through this once, maybe twice, but it's like being a deer in the headlights. What do I do? How do I do it? And where do I begin? And to have somebody help guide you through that process really has taken the burden off my clients. Usually after I've engaged a client, they're like, I feel better. Now I know I'm working on it and you don't have to. So it works out well.
I mean, it's such an important piece to have someone that you can really trust, who can be your guide and that can help you through this process. I mean, even, those people who work in healthcare regularly, there's still a lot of confusion, like skilled nursing versus senior living. So when you go through the process of, meeting with your clients, like, how do you describe some of those differences in terms of what to look for?
Well, the differences that are out there, you've got independent living, which you're pretty independent. You might need some help with med reminders or whatever, but you can walk on your own, you can still drive, you can enjoy life as you used to. You've got assisted living, which means you need some help with some of those activities, whether it be toileting, dressing, bathing, things that take a little more ability to do. Then there's also the memory care component. If your cognitive issues are declining, you may need memory care. And then if you really need a lot of nursing care, we've got the skilled nursing. So looking at the spectrum and looking at your own parent and determining where they're at, what they might need currently, and what they might be needing down the road. That's where we kind of start and try to determine where we're going to start looking. And at this time, in the pandemic, again, we brought the services into the home, which again, if you Google home care, you're going to get quite a few hits. Which ones are good? Which ones are reliable? Which ones do you want to avoid? And then again, that's where I can guide you through that process.
So in addition then to potentially helping family members find a place where someone can live, you're also now helping them through the process of potentially bringing support into the home. Is that right, Jan?
Absolutely.
Yeah.
Yes.
And so when you help them with that, whether they're looking at a facility or whether they're looking at bringing support into the home, what kind of questions and concerns do you help them address? What are some common themes that you hear from them?
Well, the first thing is to see what's really going on with their senior. You know, what is the problem that they're looking at currently? And then that will determine the next set of questions. But the one really important factor is the finance. How much can you afford as far as care? You can bring care into the home, but at a certain point, that becomes more expensive than moving into a community. So we really have to have a good feel for what the budget is going to be and what that looks like. And when I first started, I thought, we won't have any Medicaid. Why would we? Well, not many people can pay for their care for years and years and years. So that's another important component to evaluate. Are we going to be needing to look into a Medicaid community?
And when you are evaluating different fits at different facilities with clients, like what are some areas where you think, oh, this is a red flag, or this is an area that seems like it's going to be a really good fit? What are some of the variables that you look at with your clients?
Well, with the client, I like to find out, are they chandelier people? Do they want something really pretty and aesthetically up to date, or are they good with a more homey atmosphere? Are they inclined toward a certain type of religion that they really want to stay within? Because there are a lot of different communities to choose from, and that kind of changes where we will look. The other thing that we really look into when we're looking for the communities are the personnel at the community. Have they had a stable personnel, or are they always changing that executive director? Are they always changing out the salespeople? If a community cannot find the right employees and make them happy and keep them comfortable, what can they do for your loved one? It's always a concern for me. So those are some of the things that I look at. The other thing that's really simple is when you walk into a community, what does it look like? Does it smell? I walked into some and I just turn around and walk right back out, because there are some things that if it's not clean and if it doesn't smell good, I don't think I want anyone to move into that area. So that's another simple thing to look at when you're looking.
And I know you've shared too that there's a lot of information that's now publicly available for people to look at even prior to visiting a facility, right?
Absolutely. You can go online and you can see the number of COVID cases, how that's affected them. You can see how the communities are rated as far as with the IDPH. And so you can see a lot of what's going on, especially in skilled nursing online, even before you get to the community itself.
And I know that, Jan, you had shared with me in previous discussions that there were a number of facilities that were really proactive when COVID-19 hit. I mean, can you think of an example that you can share with us about that?
Right. Well, there was one CCRC, a continuous care retirement community, and they got slammed with the COVID-19. So they started calling the families, first of all, to inform them what was going on. And secondly, for the people who were in independent living to say, you know, if you want to take your parent out, we totally understand. And we really are recommending that at this time, because when everything started, no one really knew how to contain the spread. And so I feel like sometimes the best places got hit, but how did they address it? That's what's important. Some places didn't get hit, it's still kind of a mystery. But, you know, it's just this virus that's such an unknown. But if the people are really communicating with the families, that's what's really important.
So important.
So Jan, when we think about, you know, moving forward, I mean, things are changing hourly. Things have shifted a lot regionally across the United States. I mean, what words of advice do you have for us moving forward as we try to support ourselves and our loved ones during such a time like this?
Well, I think that the key is to really look at what type of changes you are thinking about and finding what the protocols are with the service providers. How are the home care companies addressing the safety? Are they testing their employees daily? You know, what kind of protocols do they have in place for all their employees, which then translate for safety for your loved one? There are a number of home care companies that will only send to one client the same caregiver. So you have to have the same caregiver. They're not splitting them between you and somebody else, because that would just be, it could be dangerous. So again, looking at the protocols that are in place currently with the independent and assisted living communities, they're now starting to open up and allowing people to move in. They all have their different rules and regulations, and learning what the rules are important, and it's something you can live with.
Jan, in the Chicagoland area, what are the visiting regulations right now? Are they allowing visitors to visit their loved ones in these? Yeah, I know you can't go through every single one of them, but what is the gist?
Well, if you have outside space, you can visit. And okay. Most all of these places, you usually have to set up a time slot, of a 20 to 30 minute time slot. You sit outside 6 feet apart with the masks on and visit. You are not allowed yet to go into the communities to visit. Some communities are allowing their residents to go outside of the community, perhaps visiting with the daughters or the sons. There's one in particular that you can stay out for 23 hours and come back in. You still sign in, you get the temperature taken. If you're out for an entire day, then you have to self-quarantine. So again, that would probably be that point where you want to come in at 23 hours. So you don't have to quarantine for 2 weeks.
Wow. Thank you.
Mm-hmm.
All right. Well, thank you, Jan Steiner, Managing Partner at Senior Transitions Concierge. If you'd like to connect with Jan, visit seniortransitionsconcierge.com. Feel free to call her at 847-340-7073 or email her at jan@seniortransitionsconcierge.com. And of course, you can connect with her on LinkedIn as well. In the meantime, be sure to check back with Wendy and I as we continue our conversations with medical experts as we help the confident patient in a new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you so much, Jan.
Thank you.